Hi, everyone. This is Dr. Helen Sue. I get a lot of questions about Asian American mental health in general, and I thought maybe an easy way to share would be to share parts of a presentation that was created for the Asian Pacific American Medical Student Association. So APAMHSA had invited me to speak a little bit about the history of Asian American psychology last year. Actually, it felt like another lifetime earlier this year. And so while not purporting to be the authority, because there is no one ultimate authority, this is a great overview if you're new to learning about Asian American psychology. And so I'll share with you in pieces, and I will break this presentation into several short videos because it's a little bit lengthy. There's a lot of things that I cite that you may want to look up and follow up on later. All the other great contributors to the fields, the intersecting fields of Asian American psychology. So I will just start with the first part. And this presentation was called Ancestors to Influencers. So a brief overview of the past, present, and the future of Asian American psychology. And I bring this to you as the past president of the Asian American Psychological Association, and in my current role as staff psychologist and liaison to the Asian American Community Center, AAPI at Stanford University. Now, I always like to start with what actually brings us together. What's your interest in this topic? I'd really love to know. Are we here as a student, a grad student, a clinician, a professional, social worker, a LPC, marriage family therapist, psychiatrist, psychologist, or a researcher? You may be looking into this as an academic in academia, in sociology, ethnic studies, psychology. Are we a client or consumer? Someone who actually has sought services from the mental health profession as a client or consumer? Or a family member or a loved one? Do you have a family member or someone you really care about who is a client or consumer or lives with mental health conditions? Or are we just a community member that cares about mental health as an issue in our communities? I know a lot of people are very worried, for example, about youth mental health. And I always like to start with saying it's good to think about what brings us all here, all the different intersecting parts of our communities that care about mental health, including faith communities, educational communities. And I also want to say that these are not exclusive categories. I have been and am every single one of these things. A graduate student, a clinician for 20 years now, a researcher on some points and published several academic chapters. I've also been a patient, and I've also been a loved one and a family member of people with mental health struggles, conditions, traumas, and I'm a community member. So primarily my work is inspired by how deeply I care about how we as a community have to fight to decrease mental health stigma and increase funding and services for our communities, which is what this is all about. Really quick background info about myself, why I speak about this. You don't need to read all of the details, but the TLDR version is I started in hospice and geriatrics, then went to K-12 educational, school-based clinical work, and now currently at Stanford University. I've spent most of my career in nonprofits, serving really in the communities, doing home-based work, school-based work. I'm a clinician and educator, a supervisor, very much an advocate in a lot of my spare time. Have done some consulting now for Netflix, on social media. I consider myself a digital immigrant. We'll talk more about what that is. And I'm not quite an ancestor, definitely not an influencer either. And I come to this work as an immigrant myself from Taiwan, as a bilingual and bicultural clinician. I do want to start with saying, who are we even talking about with Asian America? Are we AAPIs, Asian Americans, Pacific Islanders? Do we also include Desi Americans in this group, South Asians, include mixed race parts of our community? So Asian America is an umbrella term, but we have to remember that that's something that only exists in the United States that for political and historical reasons, we're sort of lumped together here, even though we have very, very many unique cultures. And as I always remind people, you cannot see us as all the same. I'll get into some more of the reasons why in population demographics. But I always say, remember that many of us in our home countries historically have literally been at war with one another or still are in great conflict. So we're absolutely not the same. But here, for political reasons and some cultural, we are kind of lumped together. So who's Asian America? We are about 6% of the total US population, and we are the fastest growing group as a whole. And 6 groups make up almost all of the current total Asian American identified population. And those are people with ethnic ancestral backgrounds, which are Chinese, Filipino, Indian, South Asian, Vietnamese, Korean, or Japanese ancestry. So about 6%, but growing. A really fantastic website for all things demographic, beautifully done, is AAPI data. So I definitely recommend you check out AAPI data. They have all kinds of beautiful research and graphs to help illustrate the data. But for example, this is one chart that just talks about people obtaining legal permanent resident status by broad class. And I included to give you an example too of how not only are we ethnically from all kinds of different ancestral homes, others are also here as fifth, sixth generation Americans, and others are here as recent immigrants on work visas, refugees and asylees. And so we all have very, very different experiences of what it means to even be an AAPI living in the United States. And I like to include this picture also to remind people that we also look different. There's a lot of people talking about how come when you see a lot of mainstream articles talking about Asian Americans, they only seem to think of East Asians, Japanese, Chinese, Korean, when actually we have so much breadth in our community. And these are some of the people. I have an addendum at the end of the slide that you should look up for your own good. Brilliant people in our community, scholars such as Don Mabalon, Sarabit Chima, who is on the school board and a political candidate in the city where I am, past presidents of the Asian American Psych Association, staff at YNA Health Center in Hawaii, Bo Chan, who is a local artist in Oakland. So we are of all generations and intersectional identities, and I want you to really hold that in your mind whenever we think about who are Asian Americans. Definitely not a monolith. And in fact, we are a completely bimodal population. What does bimodal mean? That means that we have huge data jumps of who we are on some of the lower ends of spectrum, like any topic, such as this one is median household income. So we have some of the absolute highest earning median household incomes in the United States, and also some of the very lowest. Same thing for things like educational attainment. We have some of the most high educational level attainment groups, and we have some of our communities with very high school dropout rates and low levels of educational attainment. So having these very, very different ends of the data points that we're all in ultimately winds up totally obfuscating all these details. Now, you know what happens when you don't disaggregate the data and you have data points on two different ends, you smush them together and it looks like a normal curve, which is absolutely not. And the lack of quality disaggregated data, because we get lumped together, very seriously impacts research and funding. We are not your model minority. How we define minority and how we present data has real impact on resources and knowledge. So again, this is another graph showing that education level is extremely different depending on which parts of the Asian American communities you're looking at. And so again, this matters for things like funding. When programs are there for education, for social services, all this sort of thing, they will look at a data point. And if it just looks like Asians are fine overall, this whole model minority myth that actually leaves huge swaths of our population completely without any support, any funding, and invisible as far as the data is concerned about what their needs are. So the overall objective of this whole presentation is to provide the overview of how Asian American mental health has evolved, professionally anyway. So from my limited sort of perspective, and to understand and introduce some of the actually innovative programs and approaches that do target the mental health needs of Asian Americans that have been created. And I've put some photos here of Pat and Lily Akora of the Core Foundation. Definitely look them up. This is Dr. Ramani and also Dr. Reiko Hama-True, who was president of AAPI when I was a student. Definitely ancestors and influencers. And I want to mention this idea of ancestors, that on every area of our very unique backgrounds have all had mental health and health knowledge and wisdom. And those are positively ancient. They're often integrated with mind, body, and spirit health, and ideas about community health, that all those things are part of health. How you move your breath, how you move your body, how you balance what you eat, how you relate to others, your spiritual health. So I'm not an expert in these areas, but these are just a few examples. And I want everyone to actually think about that, because there tends to be a way that traditional Western education presents mental health concepts as if they were invented suddenly in Western countries, and as if all of these old, ancient, wise traditions worldwide didn't have awareness that there were conditions where people would become mentally, emotionally unbalanced, and had ways of treating this. And one of the conversations we've been having more recently, for example, at Stanford, is really thinking about that, decolonizing ideas about what mental health really means. That remembering that when we talk about evidence-based practices and the type of psychology that we usually get tested on in our formal Western educations, we're talking about psychological science based primarily on a very small, privileged, and biased population. What's been called in the research the weird population. So we have all this evidence and psychological data, but it's largely based on samples and populations which are Western, highly educated, industrialized, rich for the most part, and democratic. And as I always say, we're not minorities. We're the global majority. The majority of the world's cultures, for example, are collectivistic. And so there are studies that say actual weird populations are probably about 12, 15% of the total world population, and yet so much of the majority of psychological research is based on weird populations. And so if it sometimes feels like what we learn formally about mental health doesn't fit AAPI communities, this is why. It was never actually normed, studied on our populations. And so that's a big part of what our current researchers are doing, is creating that body of knowledge. Because the question is, how do we provide mental health care to those who may suffer from things that include internalized racism, the traumas of imperialism in our histories, internalized colonialism, the impact of migrations and separations from our old ancestral wisdom, our own spirituality. How does Western psychology know how to treat those things? And thus far, the answer has been not very well. And how do we blend the knowledge of our ancestors with the needs of our current populations? And that's what it means to think about ancestors going into our influencers, our iGen. That we can think about how to bring ancient healing into a modern contemporary world. We can think about ways that heal, that are community-based, familial, creative, doesn't have to take place in a therapy office one-on-one or on telehealth one-on-one, maybe artistic, could be integrate spiritual, integrated, holistic, can be vocational, And this is a slide from a Filipino mental health initiative presentation at AAPI one year that was a beautiful presentation about how drumming circles was used and social media has been used. So ancient knowledge as well as very new tools to be a place of community healing. And I'll stop the first section of this series of talks on this, and I want you to really think about it. Why has it been so hard to find writings, interventions, publications that talk about how do we integrate ancient wisdom and cultural values and community norms and spiritual practices with contemporary treatment models? And that goes to research. So when we talked about demographics, not being counted, being labeled a model minority who has no needs, no problems, that has an impact on things like funding. So think about this, US taxpayers. The National Institutes of Health only fund less than 1% of projects focused on the health needs of Asian Americans, Native Hawaiians, Pacific Islanders. Now, if you'll recall, we were 6% and growing of the overall population, and those on the higher ends of our demographics certainly contribute quite a bit to taxes, and yet we're really not getting work done or funded that addresses our needs. And that's a big part of why it may be hard, and it has often been very frustrating for APIs to get services that actually meets their needs. So this is an intro into Asian American mental health, a history of what that even is, ways that we can blend ancient wisdom with contemporary needs, and some of why we have a lot of problems in the United States actually even understanding or having any visibility or resources about what is API mental health. And in later sections, we'll talk more about the influencers and the ways that there are people really changing how we get information and data out and share all kinds of wisdom. But I will put that into another segment since this is a really long talk. I'm going to probably break it into about 3 pieces. So come back next time, subscribe if you'd like for more about Asian American mental health. And thanks so much for listening. I'd love to hear more comments too about what you're interested in, and hopefully that we can keep learning more about mental health and APIs and APIDA populations and BIPOC mental health. Thank you so much for your interest. Please keep it up out there fighting stigma.